Good morning, welcome to EHE. Come on inside.
EHE does take great care, not only with the physical examination, but they take our comfort seriously as well.
Preventative medicine is important. Why not prevent a disease from occurring?
Haven't felt any swollen lymph nodes or anything.
You have to educate yourself. You have to be your own advocate.
It's sort of round-the-calendar care.
I think what distinguishes EHE from other organizations is our total commitment to your entire comprehensive health care. You have nurses, you have coaches.
This will help you build a stronger relationship.
You have a whole variety of healthcare related individuals that are involved in your care.
How long does it take?
Well, the whole exam, it takes about 2 hours.
And this team approach is really what is so unique about EHE International.
It should be about the same number.
Okay, let me look in the other eye.
I'm going to let the treadmill go for just a little bit.
I had a vast array of blood work done, as well as urinalysis. There was also a pulmonary function test, which I was very impressed with.
A lot of patients like to say this is a one-stop shop.
It's a team effort. The patient comes. There's all sorts of blood tests. We screen for many different types of blood diseases.
This test is going to take about 4 to 5 minutes.
We look at their hearing, their vision, their breathing. We get mammograms where that's appropriate, EKGs, stress tests. We schedule colonoscopies. So that whole thing is the physical, including my part, which is a pretty thorough review of systems, and we check them from head to toe.
And how was everything?
It was excellent.
Good.
Great tailored follow-up approach to moving someone towards total prevention and health and wellness.
It's a dermatologist. I was wondering if it was possible to request a female?
Sure.
People don't realize it's out there for them, and once they experience or hear about it, it's a wow factor.
I'm a nurse with EHE International in New York. How are you today?
After the physical, there's the clinical intervention. If I needed to go for follow-up.
Okay, I can help you with that.
EHE's team will keep contacting me, making sure that I've had the right follow-up care.
You know immediately that these aren't people who are striving to tell you what to do. It's really a resource. My well-being is their job.
Most of my patients that I speak to are looking to lose some weight. So we definitely can figure out how that's going to work for you, and we'll do it taking small steps at a time, if that's okay. Coaching might be one of the most important aspects of this whole process.
My health coach gives me the motivation to stick with my goals.
When we talked the last time, you were trying to go to the gym 4 times during the week on your lunch break. How are you doing with that?
I've got to answer to her every week on where we are in this progress. And we're working out different exercise programs. Some things may work, some things don't, but we're able to actually tweak it.
You work one-on-one with a health coach. The sessions are completely confidential.
As a doctor, I think coaching works because it's actually a tailored approach to treating someone and following someone's health and wellness as opposed to disease and sickness.
They really root for you. I mean, you learn so much from them. She changed the way I eat, how I exercise. She changed my life completely.
Our coaches are well trained. They all have advanced degrees. They all go through an intensive training program that's ongoing. What are the current recommendations? With our medical board made up of experts from around the country in each area of medicine.
The job of the medical advisory board is to gather as much information and analyze as much data as possible that'll help us understand what's the best answer that we can then take from the advisory board and bring to the individual interactions with the patients.
I'm looking at my lab results. I don't feel anxious if I'm going on vacation and something happens. I can log in and be able to provide another doctor with the information they would need to be able to help me.
It's just, you know, really cool that you're able to just update the form and not having to fill out the whole thing every year.
Our website is a protected website. It's confidential. Patients are only able to access their personal health record by having an ID and a password.
It's not just a physical examination, it's a year's worth of service that they're there for you. There's a lot of hand-holding, and they've really been there for me. My experience with the EHE has been nothing but a positive one. And I actually tell everybody that I know, my company, you really need to have this done. You really need to go just once.
I tell patients all the time, at the end of the day, nothing is as important as your health.
And that's why we truly are your partners for a healthy life.